Oh, okay. So how do you get put on hold? Well, if you're in a Medicare, Medicaid zip code, your wait is 3.8 minutes longer than somebody in, say, a Johnson County zip code. Also, every year of that 240 million phone calls, 25 million are wrongly dispatched. They're either sent to the wrong PSAP, which is your dispatch center, your emergency communication center. So roughly 65,000 people per day that need 911 are experiencing significant delays of 3.8 minutes or longer. So these are the problems with the different PSAPs of calling 911. You might get put on hold. Maybe you have a bad connection. We all know cell phone calls get dropped a lot. That delays time. As they're trying to ascertain your address, there's human error. Maybe you live on Northeast, but the dispatcher put Northwest in. Now you have a 30-minute delay. The location is, again, just approximate. It's not an exact science. At night, your streets are poorly lit. They can't see or read your house numbers. When they get there, whether it's police, fire, or rescue, they don't know you. They don't know your medical history. Maybe they think that you're on drugs, but you're actually just suffering from low blood sugar. And also in cases of scene safety, let's say you're having a burglary or a hostage or kidnapping. Police cannot see or hear what's going on inside. They don't know who you are. They don't know the history of your house. They don't know if somebody in the house has a violent past or tendencies. So let me move this side. So all this results in delayed treatment and poor patient outcomes. When your loved one calls 911 for you, or even just a bystander, most of the time they don't know what to do. They don't know how to help you. A lot of people don't even know how to provide basic first aid, such as CPR, the Heimlich if you're choking, a tourniquet if you're bleeding, how to use an AED if your heart stops, or simply how to administer Narcan, especially with fentanyl being such an epidemic, or even an EpiPen. So maybe they want to help you, but they don't know how. And maybe they were trained in CPR or basic first aid, but during a time of panic, they forget how to administer it. So how are we going to solve all these problems? Well, we're going to solve them with Glownar. So the software portion of Glownar is, so you get Glownar, you download it to your phone. First, you're going to fill out your family profile packets, every member in your household. All this information is voluntary. You put what you want, and you don't have to answer every field if you choose not to. But we'll get your profile photo, your name, your date of birth. Then, if you want, you can upload your diagnoses, such as maybe you have a family member in the house that has dementia. I myself have autism. There was a time when I wouldn't be able to communicate what my address is or what my needs were at the time. You could put that information in there. Maybe somebody is deaf or hard of hearing. You can put your allergies in there, your med list in there. Also, what we do is when you download it, we're going to triangulate your location. So before I said 83% of all calls are made through a smartphone. It's an approximate science, but what we're going to do is have you go in 3 areas of your house. It's going to triangulate exactly where you are and right down to a science. So if you're on the 2nd floor of your house in the back bedroom, we're going to know. We'll also save your 911 calls and the data of that call, such as the transcription, the date and time that you called. This is necessary if you need to notice a pattern with an elderly loved one who maybe isn't taking their meds and has to call 911. Maybe you have a domestic violence situation, you need a temporary restraining order. We'll have that data there for you to provide to the judge if you need it. What we also do is when you call, once you place that 911 call, up to 5 emergency contacts that you list will be notified. We'll send an alert through that will make a nice little sound like to get your attention, and then let you know the name, which person in your family profile packet or just your neighbor, whoever called, where exactly they're located, and the description of the emergency. This may not seem like a big deal, but let me share with you a story about a local person that some of you may know, Bishop Tolbert. Bishop Tolbert is the president of the Board of Police Commissioners. Last year, unfortunately, his brother was at the family church by himself and he suffered an asthma attack. He called 911, got put on hold, got disconnected, called 911 again, got put on hold. By the time 911 came on the line, he was no longer responsive. It took him about an hour to triangulate his location and to get there and rush into the church. Unfortunately, his brother passed away. One of the worst parts of the situation is the fire station was located less than 50 feet outside the church door. Nobody knew, his family members didn't know that he called 911. With Glownar, we would have sent those alert notifications to his family members. Anybody with a Glownar app in a 3x3 area would have known. The fire station would have known. His brother would have known. Some of the other safety features that we have is a one-touch dial to 911. As you can see, let me move that. As you can see down here, let's say you don't have time to answer any questions or to talk to 911. Simply put the SOS button and we'll go ahead and transmit all this information for you. And if you can't answer any other question, at least you know that 911 or the call center knows that you need help. So will your emergency contacts. We'll voice activate it. Let's say you fell in the bathroom and you can't get to your phone that's in the living room. You just got to shout, "Hey, Glownar, call 911. I've fallen." And we'll call for you, as well as push it through to your emergency contacts. Let's say you have a burglary in progress. Anybody in that 3x3 block area of you will also get a notification to their house that a burglary, home invasion, or other safety, not medical, but safety emergency has been triggered. So that maybe if someone's burglarizing your house, they can take their loved ones to safety in case that burglar decides to flee and take refuge in their house. We'll also allow police to access live video and audio feed of the scene. Let's say you have Ring cameras on the inside of your house and you need 911 or you need the police to be able to see what's going on. Maybe it's a hostage situation. We'll provide, if you let us, that's one of the options that you have, to provide them audio and video of what's going on. Down here, we also provide life-saving videos and audio. Remember when I said that during a time of emergency, some people don't know basic CPR or they forgot how to do it? Once you call 911, on your screen will be videos and audio walking you through basic life-saving information until 911 can get on the line with you. Remember, if you're in a lower income area, you have a 3.8 minute longer wait time. The National Heart Association says when you suffer a cardiac arrest, every 1 minute that goes by, 12% of your good outcome goes down. The national average for EMS is 7 minutes. So when they arrive, you're still looking at about a 20%, 25% chance of survival. If you can start CPR within the first 60 seconds of somebody dropping, then they have a 93% chance of survival. We're going to give you that audio and video until 911 can get on the line and take over. We also have what's called push-through calling. So let's say you download this app, right? Why would you call 911 through Glownar instead of just dialing 911 on your phone? Despite the features I listed previously, the reason would be, let's go back to Bishop Tolbert's brother. He got disconnected. He got put on hold. He was unresponsive. He could no longer communicate. Just a simple fact that he would have hit SOS and even a prompt that said asthma attack based on his medical history, because we'll have prompts for things like that as well. Maybe you can answer them, maybe you can't. But if you can, and even if you can't, we're going to push that information. If you are unresponsive, if you get put on hold, if your phone gets disconnected, if you've lost your wireless signal, we will still push that information through to 911. They will get a call from us saying, so-and-so at this location has triggered a need for emergency services. due to asthma, due to a burglary, due to whatever the case may be. We're going to get that phone call through to them. They won't have to sit there and take an hour to figure out who you were and why you called. Um, so sorry. Or maybe your phone died or it was taken. Let's say somebody did break into your house. You can't talk. You got to remain quiet. Maybe you got to turn your phone off because the glow of it is to be seen from a dark room. Maybe it's domestic violence and somebody got mad that you called 911, took your phone and checked it. We're still gonna, after 10 seconds, if you don't hit send, we're gonna send it for you. Um, and then the other thing that I wanted to talk about just a little bit was the hardware solution. Now, we are filing the patent for this, so I can't go into too much detail. But I mentioned earlier some of the problems with 911 being able to find you. So EMS or police are coming down your street, it's dark, it's going to take them a few minutes. Also, let's say if they get to your house, we want to make sure they're at the right house. Our hardware solution will allow them to find it much quicker from a further distance away. And you'll have confirmation, they'll have a double confirmation that they're actually at the right house. Again, I know it seems kind of vague, but it is because we're still filing that patent. But so yeah, so this is what Glownar is aiming to do. The 911 system is broken. It's just not being updated, which is allowing us to have a hardware and software like this. But a lot of people don't realize until they need 911 the issues that could come about, and by then it's too late. So with that, if anybody has questions, I'll take them.
That's great, Dani. Thank you very much. I actually would start out with just kind of how you really came to this solution. What kind of was your inspiration? You've clearly understood the need. What kind of drove you into it?
Sure. What drove me into it was, like I said, I have autism. There's a point when I couldn't communicate. I wouldn't be able to talk to you. I wouldn't be able to give you my address. If I had an emergency in the house, you wouldn't know it from me. Or let's say my parents had an emergency or were unresponsive. The second they show up with lights and sirens, I'd be hiding in a closet and never come out. First responders wouldn't even know that I was there. So taking into account the special needs of different people, was really important to me because you need to be able to have first responders and emergency care, even if you can't communicate. So when I started looking into that, I started understanding the other issues that arise from 911. So when I realized that there are all these problems, then I spent like 3 hours and figured out the solution.
That's great. What has been the response that you've gotten? Have you been able to present this to any EMS services?
So I have gone to quite a few, Kansas City, Riverside, Gladstone, Johnson County, the Mid-American Regional Council. I've gone to countless people. They all love it. When I was one piece of information I'd like to give you is when I was talking to Chief McGee at the Gladstone Fire Department. I was explaining to him the software and hardware, and he said one of the most important things that they would like to know ahead of time for a fire is mobility issues inside the house. When they respond to the fire, they don't come with equipment needed to extract an immobile person. It's too heavy and it's just they want to respond quickly. If they know ahead of time that you have mobility issues, they can give you an extra 30, 40 seconds that they wouldn't have before because they'll bring it with them. And another thing that he said was when I was explaining the hardware to him, I asked him, how much time do you think this would save EMS or first responders to finding your house? He said, I bet it saves a good 30 seconds. I said, okay, it saves 30 seconds. Is that even necessary? Do we even need 30 seconds or is it just an insignificant amount of time? So what he said was, here's how I'll quantify 30 seconds. 30 seconds during a cardiac or a breathing emergency is a difference between me playing with my kids in the sprinkler in the summer versus having to sit in a chair on a porch and watch them. That 30 seconds can be life-changing in your outcome. So the response overall that I've received from everybody was really, really good. They all love it, and they all want to use it.
And that's great. What about the rest of the group? What other kind of questions do you have? Please either raise your hand or just speak up.
So I do see a question from Rebecca McKinnon. How will you grow across the country? Right. So Next Gen 911 is how they are turning the PSAP centers from analog to IP. Within that, you have a company called Rapid SOS, which is the only company allowed to communicate as an intermediary between softwares like mine and the dispatch centers. The reason being is they can't risk 18 different software companies trying to talk to them and bring down their system. So this is the only system in place that you go through. So they are in 97% of PSAPs. And about 2 weeks ago, I closed a deal with them to be able to get into every single PSAP with this information. So it'll be in every PSAP except for ones located on tribal lands. The alerts. So the alerts for people in the area, yes, you would need to have the Glownar software. Again, it would be a 3x3 block radius. We can actually allow up to a 1x1 mile, but we figured through our market research, 3x3 was the distance that most people felt comfortable with. But yes, you would need to have the Glownar app downloaded, and we would still we would push it through to your phone, which most people have it by their bedside and stuff like that. And we're only doing safety emergencies. During the market research, we realized a lot of people with Ring hate the fact that even if a dog goes missing, you get notified. So people are kind of blind to that noise now. With us, you're only going to get safety notification for things like burglaries, home invasions, things that put you at risk yourself as well. How does the system integrate with disparate EMS communication systems? Yes. So because of the Rapid SOS, it operates on 2 APIs versus the thousands of APIs that each PSAP would take. So because of this, it's two simple APIs that we talk to, then they take that information and push it through for us.
Awesome.
Who is your target? Yeah, are you looking to sell this to municipal entities? Yes. So my target market is the municipalities. I've been trying to get in touch with Mayor Lucas to see if he'll fund it for Kansas City. So the Mid-American Regional Council is the one that handles 2 million plus calls a year for the 11 different counties on the Missouri and Kansas side. And there's also a 4-county coalition for Jackson County, Clay County, Wyandotte County, and Johnson County. And we are hoping to beta test in Jackson County because of the demographics and because people in a lower income area have a 3.8 minute longer wait time. We really want to beta test there and get it out. But yes, we're hoping to sell to the municipalities themselves, whether they absorb the cost in the name of public safety or subsidize the cost. We also will sell it to consumers. Let's say it's not in your municipality yet, but you want it. We also plan to sell to consumers as well.
Any other thoughts from the group?
Will the user pay a monthly fee for the service? So yes and no. We'll have a free version. We'll also have a premium version. Roughly $10 a month on the premium version. Again, though, with the free version, we're going to make sure that the life-saving features are free. Nobody should have to not have the life-saving features because you can't pay. We're also hoping that the city will either fund it or subsidize the costs. And the hardware, it is hardware agnostic. You don't need the hardware to make it work. The hardware will be very important in getting them there faster. And there will be a one-time fee associated with that as well.
I'm looking for hand raises. Just a second, please. Brandy, go ahead, please.
Yeah, Danny, I don't think you had any way to know this, but Aaron Tolbert, Bishop Tolbert's brother that passed away was my father-in-law. And that's why I just wanted to say that to underscore how important this is, because literally the fire department was across the street from the church, and his wife they lived like 2-3 blocks away from the church where he was at, and we didn't know that he was gone and until he was already very gone. And so to be able to have something like this would have literally been life-saving and life-changing for, our whole family. And so I wanted to know, did you actually talk to Bishop Tolbert about this? And is that how you came to know about it? Because I know he's been working with the police chief, I think, on this.
Yeah, Brandy, I had no idea, and I'm so sorry
I
for your
know.
loss.
It's okay. You didn't
Yeah,
know.
so yeah, what happened was when I was doing research into getting it into the city, I was reading about different stories that happen all across the country. And I
Mhm.
read about Mark Tolbert, and I reached out to Bishop Tolbert because when I read the story and I saw that he got put on hold twice. The fire department was literally out the front door. I thought, you know what? I want his information. I want him to tell me what features he thought would have been better. What features I want him to have a say in how this could help other people. He knows it firsthand as well as do you of how this could have changed. So he granted me a 15-minute conversation, which turned into 30. And he asked me to keep him updated and everything about how it goes. But just to be able to hear from him about what he would have liked to have seen with his brother, his baby brother, it was it was a very somber conversation. But I hope that he and you and your family out of this maybe find some solace in the fact that this will help other people and that a difference will be made, because what happened is outrageous. Very sorry for your loss.
Thank you.
You're welcome.
Jeff?
Hey, Danny. So what stage is the software and hardware solution at right now? Is
Sure.
it? Sorry, go ahead.
So, in the next 2 weeks, we should have the click-through prototype to be able to demonstrate it to people. The hardware, in the next 2 weeks, we should have a beta version of the hardware as well. So in April, we will have enough to go on to start trying to beta test it or to do a sandbox with it. So it's coming along very quickly. We started the development February 6th. And within 2 months, we'll be finished with the alpha and beta version.
Great. Are you
It's
doing it
taken-
with an internal development group?
Yeah, so I'm doing it with a dev team that does hardware and software both, based in Orlando.
Great.
I actually just flew back from Orlando. But yeah, so we spend, several hours every single day, 5 days a week, working on this to make sure that we can keep a very quick pace. And going through Digital Sandbox, one of the things that we did over the summer is called Summer in the Sand. Was we learned how to do our own wireframe models, even though I'm a non-tech founder and I don't know anything about tech. And that helped a lot to be able to sit there and take 500 note cards and develop this app. It has really helped to quicken the pace of which it'll be developed.
Great. Thank you.
Mhm.
Brandy, we also have a question about what other systems, safety systems this might integrate with: Echo, Connect, Show. Also, I would think ADT and other kinds of services that offer emergency calls.
Correct. So we are designing the hardware and software in mind of connecting with things such as the ones listed in chat, Ring, things like that. So we don't have actual partnerships yet, but we will be focusing on gaining those partnerships, especially for anything with cameras and audio inside or outside your house that you would be willing to share only during time of emergencies. Life Alert, one of the things that I would say about that is Life Alert is actually very costly. The device itself is costly, and a lot of older people don't want to wear a thing around their neck. I will say, having autism, I don't wear jewelry. I don't have piercings. I don't wear anything, or lanyards, anything like that. It's a sensory issue for me. I can barely wear glasses without it being impacting my everyday life. So this is a solution that they could have that doesn't require them to wear anything. And it's much cheaper. Life Alert's pretty expensive.
Okay. Other thoughts from the group?
So,
Yes.
as for sharing the information with the hospital, we don't have a way to share it with the hospital, but what happens is we share it with the dispatch center, who shares it with EMS. And when they arrive on scene, they can then verbally give that information to the hospital. But also, let's say, so in your family profile packet, let's say you put your med list in there, your blood type, your diagnoses, your surgeries, any implants. If you're being intubated in the field, it's good to know if you have dental implants. You don't want to knock somebody's teeth down their throat when you're trying to intubate them. So all this can be stored in your phone and shared with EMS, but when you go to the hospital, you or a loved one that's on your family profile packets can share that information right there on your phone. So you don't have to memorize it. You don't have to bring a med list that you hand wrote with you. It's all right there in your phone. What if the phone is locked? Hey, great question. That actually, I should have had that on my PowerPoint. So when you register your family profile packet, whether it's one of you, 10 of you, everybody will be assigned a QR code. Even though that your phone is on a lock screen, we will be allowed to show that QR code as long as you set the permission on a lock screen. So when that QR code is scanned by anybody, whether it's first responders, a neighbor, just a random stranger on the street, information will appear. Now, I know what you're thinking. I don't want some random person knowing my diagnoses. That's fine. What we will do is, you will have an icon that allows you to lock and unlock information. If it is locked, it's available only to registered first responder devices. So like as a police department issued cell phone, those will be able to see, those phones or devices will be able to see any information locked. If it is unlocked, such as your contact information, your emergency contact, maybe you want them to know that you have diabetes or something, any unlocked information will be viewable by anybody that scans that QR code. But yes, if your phone is locked, that QR code will still pop up and somebody can scan it.
I wanted to say something to you. When you might want to look into things like Care Everywhere that Epic uses. They already have sharing softwares and markets. And I know Cerner is, as I saw somebody was here from them earlier. I think they're a lot more agnostic in their device compatibility than Epic. So you might want to look into that as being a way to shoot it right there to the hospital. I don't know what the cost of that is. I've never set up one of those marketplace apps for them, but that would be an intermediary, maybe a quick solution to get to the hospital, but just a suggestion.
Thank you, Ryan. I wrote that down. That's a great suggestion.
Still, Danny, I, for, as you said, you're a non-technical entrepreneur. You certainly have covered so many bases here with this. This is remarkable.
Well, I'm non-technical in the sense that I can't code, and things like that. I've never done anything techie, but I think one of the great things about having autism is the way that my mind works. It's very black and white. It's very thorough and detailed. I think the way that my mind processes things. Like I said, when I had the idea for this app, it took me 3 hours from start to finish to develop it, or the ideas and the functionality. So it's just, I don't know, it's just like when I get focused on something, I'm hyper focused. So Thank you.
Well, this has really been great. Thanks so much for sharing with us, Dani, and best wishes for you. And
Thank you so much.
look
I
forward.
appreciate the opportunity to share it with you guys.
Well, we hope to maybe have you come back once it's in operation somewhere and tell us the experience that you've been having.
Yeah,
Great. Thank you very much.
thank you so much. And I'm gonna put my contact information in chat. I see some of you have offered yours as well. And then that way, if you want to contact me or anything, you can.
Great. And then Kyle has also just joined us and offered information for his contact as well.
Yeah, reach out, Dani. Happy to help.
I will. Are you related to Meredith?
Yeah. Yeah, she's my wife.
Oh, okay, cool.
Yeah.
Thank you, Kyle.
I
Yeah,
think
good to meet
Meredith and Kyle are both with us. You joined a little bit afterward. Do you want to go ahead and introduce yourselves to the group, please? Kyle?
Yeah. Sorry to join late. I'm Kyle McAllister. I am, like I said in the chat, I spent my career in the healthcare IT world. So mostly in the EHR space. I worked for Epic to start my career, spent a little time at Cerner when I first came to Kansas City, and then I've been consulting in the space for quite a while, largely in the data and analytics and population health spaces, but have dabbled all over the place. Excited to be part of the crew.
Great, thank you. Meredith?
Hi, good morning. Yep, I'm Meredith McAllister, and I'm the CEO and co-founder of Marma Health. So we are a mobile app for pregnancy and postpartum nutrition.
And our presenter from last month. So welcome back.
Thanks. Good to see you all again.
Great. Dennis, I believe you joined since we started.
Yeah, hi everyone. Dennis Ridenauer, CEO at BioNexus KC. Thanks, John.
Yes. Any others who didn't get a chance to introduce themselves? Okay, well, with that, I'd like to introduce Dr. Brandy Archie, whose solution, Ask Sammy, is dedicated to helping people get paired with the appropriate devices and knowledge for dealing in areas associated with mobility and accessibility for those who need it. So I'll leave it to Brandy to say a bit more about herself and introduce us to Ask Sammy.
Hi, everybody. Thanks for your time this morning. Excuse me. I'm excited to talk to you a little bit about Ask Sammy. I am an occupational therapist by trade, and that is where this idea came from. Because I was running into this problem, and we'll use one example to kind of talk about the whole thing. And so I'll use Sue. She her husband was in the hospital because he had a pretty bad stroke, and they wanted to have him go to a care facility, told her that she couldn't take care of him at home because of the lack of ability to use his left side and just her physical capabilities of being able to take care of her husband. But she was pretty determined to make sure that he did make it home. And so, people rallied around her, and they actually referred her to me through my local business called Accessible Living, in which we were sending occupational therapists out to the house to figure out what people needed in order to stay in their homes and what adaptive equipment was required. So we're talking about things like ramps, and how long should my ramp be, and where should I put a grab bar? And that's kind of the information we were providing. The problem was she lived outside of our driving radius, so we couldn't really get to her effectively. And even though the rehab team at her hospital was really skilled at knowing what he would need in order to live a functional life, they don't know what can happen for him at home. And so the things that they were recommending, is it going to fit through the door? Is it going to roll on their carpet? Is the bed the right height? Those are all things that if you don't have eyes on the scene, you don't get that information when you're working in a facility or a clinic setting. And the other thing that's kind of really key is making sure that people have what they need before they get discharged. And that happens very rarely in our healthcare system because home modifications and adaptive equipment are not covered by insurance most effectively. There are a few things that come into the home, and we all expect that if something happens to us based on our health, that our health insurance will take care of us. And the example that I use is if you were to have an amputation, we'd be able to get you a wheelchair and a prosthetic maybe through your insurance, but you couldn't get in the front door because you'd have to pay for your own ramp. And people don't usually find that out until the last minute. And so she was dealing with the same problem, and there was no consistent or reliable way to ensure that she got the right stuff home. Now, I'm the kind of person who can't leave a problem unsolved. So I figured out a way to do a virtual assessment, and we got her what she needed, and we made it work. But it made me start thinking, how much more impactful could we be if we just had eyes on the scene, or we didn't have to actually be present in order to pass on this information to people who are coming home every day. And so the solution that we came up with is Ask Sammy. It is a progressive web app. So if you access it from your phone, well, it'll prompt you to download it. So you have it readily available. This is great for clinicians, but you also can just go to it on your desktop or any browser. And then you answer a few questions about the problems the person is having. And you get clinically based recommendations on the right adaptive equipment to buy, the services that you need to connect with, whether it be home health, or we think you should probably have a fall alert button. And then also there's free resources to download. How do I get a hospital bed through insurance? What are the steps for that? All of that is located within the application, and you get prompted to get that information based on what you tell us. So if you're not having any problems with mobility, we're not going to talk to you about how to get a wheelchair ramp. But if you're talking about vision, we're going to connect you with low vision materials, things to purchase, also free resources like the Wolfner Library in Missouri, where you can get those books downloaded. And so we've put all of that into one place so people can access it whenever they want to. And we've made the questions in a way that is easy for anybody to answer. And we want anybody with knowledge of the problems to be able to do it. So it doesn't have to be a clinician, but it certainly can be if they're trying to help make sure that their patient gets what they need. We've also added a feature that if they're still not sure, or they use it, or maybe they just think that it's a tricky situation and want to talk to somebody, we've added the ability to schedule a virtual assessment with an OT. Since we figured it out for her, we figured it out for everybody. So if somebody needs to have eyes on the scene or just wants the hand holding, we've got that option available as well. So here's a little bit of how it looks. When you get to the, when you decide to do the guided assessment, it starts here, and we've broken it down into 6 problem areas. And then you just keep answering a few questions. We try really hard to make sure they're simple. The pictures indicate what they do. And then eventually you end up with the results. And when you get to the results screen, we're giving you like multiple options for solving the problem. So then you click on the view the product and you get the details, and you can say, I'm going to go with this bar over this bar, and this makes sense for my life. We've got a lot of detail there about why this works in our language, as opposed to just a product description that tells you a bunch of numbers and inches. We say why this works. This is great for this person who does this in this situation. And you can match yourself with that if that works for you. So we feel this to be really important because I think we all know on this call that this is a growing market size. And as of 2019, 54.1 million Americans are aged 65 or older, and that's increasing, right? 94.7 million by 2060. Now, the average out-of-pocket health spending for those who are 65 and older was $6,833. And this was a couple of years ago. Out of that money, $293 is already being spent on medical supplies. Okay, so that's what's already being spent, not even counting the things that we need to do as we get older, and our housing stock doesn't really afford us what we need in order to stay functional in our homes. And out of those people who are over 65, 40% already report having difficulty with mobility, which is one of the primary reasons people get referred to us or have trouble with managing life at home. So this is a huge, huge market. And Ask Sammy really provides a way to make aging in place available to anybody, no matter if they are a homeowner or a renter, because most of what we have been sold, I guess I'll say it that way, is that in order to age in place or to stay living in your home, you're going to need to own that home, and you're going to need to remodel the bathroom and build a ramp and do all these very permanent things. But when we focus on adaptive equipment, it makes it accessible for anybody, because most of the things that we have in there, I would say 99% can be installed easily and also taken out easily. So people who are in apartments can use them. Even if you're in independent living and you don't want to move up a level to assisted living, we've got solutions there for you. So our go-to-market strategy right now, the site is live. You can go there. We've been beta testing since the end of February, beginning of March. We are actually having a launch and a launch party in April, and that's going to be our official coming out party. So it's available to use now, but we're really going to have our P's and Q's done for April. And then we're focused on growth and getting the word out to everybody to use this as a tool. We have a couple of things on the horizon as far as adding a more formal OT on demand platform, which I'll talk a little bit about in a minute. And then in 2024, we would really like to be able to partner with hospitals and health insurances in order to provide our solution to them. So right now, we're focused on direct to consumer. And so we're reaching out in those ways. We're reaching out to clinicians, and the American Occupational Therapy Association conference is actually in Kansas City in April, thus our launch party. So we'll be able to speak to really one of our very strong target audiences, up to 7,000 OTs there. And we also have a set of enterprise resources in order to connect with healthcare agencies. And we're focused first on home health and in-home care. And I'll talk a little bit more about those details on the next slide. And then the other way is through service partnerships. And so we want to be able to connect people with pharmacies and the other things that equipment can't necessarily do for you, but you still need those things in order to have a safe setup at home. We have a few of those services built in, and we want to add more of those that are accessible to people all across the country. So right now, our competition is kind of threefold. None of it meets the need, which is why we built Ask Sammy. But the way that people solve this now is either go to a local medical supply store and get whatever is on the shelf right now, or maybe remodel if they have the funds to do that. But that lacks the ability for anybody anywhere to access that, right? Because if you live in a rural area, you might not have a medical supply store. You might not have a remodeling company that's aging in place certified. So you're missing the accessibility everywhere. From the healthcare standpoint, you have plenty of knowledgeable people who can tell you what might be helpful and point you in the right direction. But because the majority of these things are not covered by insurance, they're not able to write you a prescription and make the thing happen. And so you're kind of on your own for that. And even some of the most helpful people who work in home health are not allowed to pick up the things for you and bring it to you, even though they're coming to your house, because that's a liability for the company, right? And we're not supposed to be exchanging money that way. And then, so what ends up happening is people buy things by Googling, going to Amazon, and getting it from those kinds of retailers. And while you can find a fair amount of products there, you're missing the clinical expertise. For example, if you do a search for a shower chair on Amazon, you get 963 results, and they're not all the same. And there's good reason for that. But which one is the right one for your setup? You don't know that unless you spend a lot of time looking. And so we're cutting that part out by giving that clinical expertise and pulling all of that into one place. So as a marketplace, we've got a bunch of offerings. So we talked about the guided assessment. One key feature that we have added is that clinicians or families can build a cart and share that. And so let's say I'm an OT and I know I want my patient to have items 1, 2, and 3. I can find that on the site, put it in the cart, share that link directly to the cart with the family so that they've already see this is exactly what we need. We're just going to order that and we'll be ready to go by the time it's time to go home. We have the virtual visit available, which is amazing because it puts our eyes on the scene, and we're really skilled at being able to pick out what the problem areas are. And as long as there's somebody there who can work a phone or a tablet, we can direct them to see what we need in order to get you the right recommendations right away. It's an affordable way to go about it. There is a small fee, but it lets you get the access right away. Our normal healthcare system requires, if you're going to connect with an occupational therapist and use your insurance, you need a prescription from your doctor. You need to find an OT that takes your insurance, and then you need to connect. But if you're getting ready to get discharged and you need answers right away, or maybe you are planning a remodel and you want the reference from an occupational therapist so you can build this stuff in right now, you don't have a medical condition that even warrants occupational therapy coming to your connecting with you, but you could really benefit from our knowledge. And so this gives the option for that. Our enterprise solutions is to partner with home health companies so that we're providing training on how to use Ask Sammy, and then also adding these other services around it that help their business. So we have a ton of continuing education already ready to talk about home modifications, adaptive equipment, aging in place. And so we can provide that to their clinicians in this package. We also, if they sign up for an enterprise solution, we'll get a discount code for their patients, because that's a huge barrier, is being able to afford some of these things sometimes. And then for the people who need it the most, we'll offer equipment credits on a quarterly basis so that their healthcare team can decide, hey, Mr. Smith needs to discharge, but we really have been struggling to do that without him going back to the hospital because he is missing a ramp to get out of the house, so he's not going to his doctor's appointments. You know what? Let's use our Ask Sammy credits to get him that ramp so that we can have a safe discharge from home health. So we're looking to be able to partner with organizations in order to provide that. And then we're really excited about in the future, we're building an OT on-demand platform in which OTs will be able to provide virtual visits and leverage our algorithm to figure out what equipment is needed and build their own businesses that way. And then clients are going to also be able to plug in with that. And so while we'll start here at the adaptive equipment space, that will have legs to be able to grow in other ways. Because what's really key and happening at the end of the year is that the OT compact is going to go into effect, so that if I have a license in Missouri, I can also still see a patient in Vermont if they're in the compact, and it will be allowable. We haven't had that availability yet. So that'll allow telehealth to grow. And so we believe that by having all of these services in one place and being the hub for all things adaptive equipment and occupational therapy, that's like a natural outgrowth of that. So we're looking forward to that as well. For our team, I do have a technical co-founder now, which is awesome. And so Willie is helping us build, continue to build into our future. We've got a team of a board of advisors, and we're always looking to grow because, like Dani, I'm a non-technical founder. I'm coming at it from a healthcare perspective. And so I'm happy to have all of this help on board as we continue to grow. And so right now, we could really use your help. So the first thing is, I really hope that you'll attend our launch party. It's going to be a great networking opportunity. You'll get a chance to meet the team. It's a great time to hang out on a Friday night at Spark KC downtown. And we're going to be inviting all of those occupational therapists that are going to be at the conference to come there as well. So if you have a desire to connect with them, it'd be great if you came to our launch party. Also, please do share Ask Sammy as a resource for anyone who's caring for an aging parent, any clinicians, anybody who sees people in their homes. Just head to asksammy.com and get started. And then we'd also really love warm introductions to home health and in-home care leaders so that we can talk to them about our enterprise solutions, because that's a great way for us to get some adoption and move forward. So what questions do you guys have for me?
We have one in the chat from Teresa that's, do you tie procurement that is real-time or ordering and reimbursement documentation per medically necessary?
Okay, that's a good question. And the answer is no, primarily because 99% of the things that are available for the home are not covered by your insurance. And so you need to have medical necessity in order to get things through insurance. And so that's why we have created like a free downloadable resource to show people what the steps are to do that, but we're not able to do those steps for them because we're also not able to bill insurance for the items. So we want people to know what they can get through insurance and how to access that, but we are not going to be able to provide that because Medicare only works with a small number of DME companies per city area, and we haven't gone that direction. But we do hope that in the future, we are the place for all things adaptive equipment, and we will eventually partner with a DME so that we can provide everything that's covered and not covered, but we're just not there yet.
It strikes me that I wish I would have had access to this with my parents. It would have made a big difference. I know, for instance, I have an example of exactly where this would fit. One of the federally qualified health centers in Kansas City had trouble with a patient being unable to attend the clinic, and it was originally thought to be a transportation problem. So they sent out a community health worker to check on this and found that it wasn't actually transportation that was the issue. It was the need of a grab bar to be able to get out of the house.
Mm-hmm.
So that sort of assessment would have been very important for that person to be able to attend clinic appointments and so on.
It's just so hard sometimes because you can only take your best guess when you don't have your eyes on the scene and people are not like open and verbal about what's going on. And this allows for clinicians and people who are working in healthcare of every level to essentially have eyes on the scene, because either they can have us connect with them and do that virtually, or you can really just say, hey, can you just take a few minutes to answer the questions I asked Sammy, and then let me know what comes up out of that. And then that might start the conversation to say, oh yeah, I see that if I put a grab bar over here, that'll help me get out. And here's the kind that I could use. And you just don't know what you don't know, right? And so we're trying to pull all that information into one place so that everybody can know. Ashley, I see your hand.
Hey, so this actually speaks to me on a very personal level. My brother just had a stroke at the age of 54 back in October, and we had to take him into our home and make modifications and try to go through the whole gamut. No insurance, they won't do home health, we can't do therapies. So something like this would have been super, super helpful. I mean, even being in the healthcare space, knowing what I know, I can't imagine not being in the healthcare space and trying to navigate that. So I think, first off, bravo, I think it's going to be a great product. I do have a question. I know, and it might have been a couple slides back, and I apologize, I had to leave temporarily to address an issue, but did you say that you could have like a virtual session with an OT?
Mm-hmm. Yep.
So is that 24/7 or is it scheduled, or how does that work?
It's scheduled. And so when you go to the website, you can schedule a time. We have times available so that there's something almost every day, Monday through Friday, but not 24/7 as of yet. But eventually when we get that OT on demand, that's kind of the goal, is to have a whole platform of OTs available so that amongst all of them, you'll probably be able to find somebody who you can connect with at a time that works for you. Does that make sense?
And I apologize, is it a video call or is it just?
Yep, a video call. Mm-hmm.
Okay, and then the other question I had, and I'm sorry again if I missed it during my time to wait, the cost for the patient, is it free for the patient? Does it go through insurance? If they don't have insurance, what does that look like?
For the visit?
Mm-hmm.
Yeah, the video visit is $39 and it's a 30-minute visit. So it doesn't go through insurance and you just pay that directly in order to get what you need. If you wanted to be able to go through insurance and get an OT, that's still a possibility. It just takes a lot more steps. It's not very quick. And so by charging a small amount, it allows us to be accessible to most. I'm not gonna say all, but it allows us to be accessible to most.
Nice.
Mm-hmm.
Dennis?
Hey, great job, Brandy. Great staging too. I can see that Startland startup to watch trophy right behind you on the shelf. You know what Ashley just described, I remember very vividly from the Pure Pitch Rally. The reason people, like your technology resonated was this just spoke to people like that. So there's an absolute need for this. And so really no pressure, but it's now on you to deliver that product. But the market's there. We heard it at Pure Pitch. I think it resonates with people because there's just so many of us going through this. Mine is more of a question of a partnership. I just read an article on Startland the other day that made me think we have to connect them to Brandy if she's not already connected. Did you read the article about Thrive Homes?
Yes, I did read the article about Thrive Homes, and we are trying to have a meeting, and we chatted in the past, but
Okay.
we need to definitely connect. So
Okay, well, yeah, and that was my question was, did it resonate with you like it resonated with me, needing to connect them to you? And so for those that maybe didn't see it, there's an article about Thrive Homes in the Startland, and they basically are the ones who like do the modifications, and it just seemed like a really great partnership where you could, provide access to them as maybe one vendor, but certainly a local company. And so I like that. But anyway, thanks. Great job, Brandy.
yeah, thank you.
Thanks, guys. Go ahead, Brandy.
I see Teresa's question.
Yes.
Visited with OT department at KU, and I have not. And but that'd be great if you have any connections. I'd love to talk to them. I do work pretty closely with the Rockers OT program, so I'm there a lot. And the national area AA, like the Area Agency on Aging, is that what you're saying? That would be great. Thank you. Appreciate it. I mean, not nationally, no, I have not connected with them, so that'd be awesome. And then for Chris, there's not a defined service area. Because we're focused on adaptive equipment, we are shipping these things everywhere. So it does mean that somebody needs to set it up, but the things that we have chosen are intentionally very DIY. And so while the person who needs it might not be the one who can set it up, if they have a handyman, if they have a person who can use a screwdriver, pretty much everything that's there can be done easily that way. We hope to in the future, as we gain some traction, to plug in with services like Porch, where as people check out, if they need somebody to do the install, they can schedule that with them so they can have a handyman in their service area, but we're not going to manage that process. I hope that answers the question.
Yeah, and Teresa's offered a little bit of a link, and then Ashley as well. So that's great. Thank you, Ashley and Teresa.
Hey, John, this is Dick. Let me make a
Yes.
quick, this first off, I think you caught the enthusiasm from Dennis and the rest of the participants here. It's one of the great unmet service needs in our healthcare system. And I think the challenge, there's a whole DME business that is built on getting Medicare reimbursement. And so we're bombarded with all this crap that a lot of people don't need. And finding this path like between affordability and accessibility, and then getting it paid by Medicaid or Medicare is I think you're filling a niche. And if there's some way to get this into the reimbursement system, I think obviously that's a huge accelerant. And so I would just encourage you from a regulatory and a payment side to try to find those areas where you can link into the payment system. But I love the idea that you're not waiting for that and that you're creating an affordable set of services and the kitting and packaging that families need to get, assistive devices on site. I'm not sure I picked up on this about, like, could someone take their smartphone for that half hour and do a virtual tour of their home? And did you say you're doing that as part of like a service? I mean,
Yes.
I really like that idea because that, you will see things like that's a throw rug, that should not be there. All the things that OTs are so good. If you've ever been part of an in-home assessment, they're phenomenal. And anything you can do to virtualize that. And so anyway, I think you're on the right path here. It's exciting to see.
Yeah, I appreciate that greatly. Yeah, I do think that it's really valuable to have actual eyes on the scene, but there's also a set of people who are working, taking care of their own kids and then taking care of their parent and just need to be able to find something online and say, okay, what is the solution? Great, ordered, I'll put it in when it comes, And so we want to provide both of those options. And to the first point about coverage by insurance, listen, I am a huge advocate. I don't actually think we should have to be in business. This shouldn't be a thing that we need to do. Health insurance should cover up to some level of this. Why is it that Medicare will pay for your hip fracture and your hip replacement, but won't pay for a tub transfer bench so that you don't fall in the shower in the first place, right? Like that costs $100 compared to $50,000. So I'm definitely on the advocacy side, but that's
Well,
not a
you
long
know why
fight.
that's the case, is providers have much better lobbyists. I'm serious.
Yeah, yeah,
I
that's
mean, our reimbursement system is tailored to those that lobby for payments. And, you know, this is a hard thing to lobby for because, you know, it's very distributed in terms of where the money goes. So anyway, I'm sorry for that political reimbursement comment, but yeah,
don't give me a
that's.
But yeah, we would love to be able to access that. And then just a point to what you were saying about Thrive Homes. So they are getting reimbursed through the Medicaid waiver program. And so that impacts a group of people that need it greatly, but it's still very small and compared to the bigger problem. And so, yes, we hope to be able to connect with them to be able to at least provide some of the equipment that they might need or to install. But it's just a lot of challenges with getting into the reimbursement model. But we hope to be able to do as much as possible and provide as many options for people for payment as possible.
That's great.
Hey, Brandy, great presentation. Good to see you again. You know, I've heard your presentation multiple times, and I don't know why I just thought of this idea. And I don't want to distract you because I think you need to be focused where you are. So this may be for your future roadmap. But as Dick was bringing up, doing the virtual visit, you know, technology is getting pretty good that you could probably capture really precise space measurement. So you could see exactly how big a door is, exactly how big the bathroom is, and everything else when you're doing that virtual visit. So just a thought, as I said, for your future roadmap.
No, I appreciate that. We're not using that technology right now, and kind of this is like a tester mode to just have it online, and we just do it through Zoom or whatever platform works best for them. But when we build our actual platform for virtual visits, I totally want to have that built in to make it easier for us to make the best recommendations possible. So yeah, I appreciate that.
Ashley mentioned a bit about whether you would be thinking about that visit in terms of integrating with augmented reality or virtual reality.
I guess I don't know enough about virtual realities to be able to give a good answer about that. Do you have more details about how you would impact that, or were you just talking about the software tools that are available to kind of just like look at, have your camera on your phone pointed at a certain area and it show up all the measurements?
Yeah. So augmented reality, I know there's a lot of products out there now, and it's becoming more and more popular where, yeah, you can take your phone, snap, you know, a shot of an area, and it can tell you, yes, this product is going to fit there, or no, this product isn't going to fit there.
And it catalog our actual product so we can know without having to be like, okay, this is 32 inches and I'm going to pick this one that says 31 inches.
Right.
Got you, to make it more automatic. I did not know that was available, and I will put that on our product roadmap.
And I actually have a local UMKC resource that could help you do that if you need. So yeah, feel free to reach out to me.
Definitely. I'm writing that down. Okay.
Okay. Other thoughts from the group? Well, Dr. Archie, this has been really great. You, as they have noted, you have generated a lot of enthusiasm amongst people here. Hope that it plays out in some further recommendations of opportunities and at least some fun at the launch party.
Exactly.
So we look forward to that. Thanks so much for taking the time with us today.
I appreciate it, and thank you for having me.
You're very welcome. And please feel free to come back and offer your input on further presentations that we have as we go through the months.
Okay, good. I will.
Yeah, you're very welcome here.
Thank you.
Okay, with that, is there any announcements or anything that anybody feels that they need to make, or we should just sign off? I think we'll go ahead and sign off then. Thanks.
Wait, I was just going to ask, I don't know, Dick, if you wanted to say anything about the 11th. I don't know if you did that earlier.
I haven't. I didn't want to, John, I hadn't agreed that we're going to go through a big KC or digital health KC, but Hey, I put a link, although it didn't show up as a link, but we just kicked off. We've been founded and supported by BioNexus KC, and we're working very closely with Digital Drive and John and his focus on healthcare within the Digital Drive world. But a Digital Health KC, guys, is doing the kinds of things that John's doing here, which is to recognize that we have this incredible ecosystem of digital health talent and companies in the Kansas City region. Some of it comes from the legacy of the Cerners and others, but we've got over 70 companies, guys, and many of them are represented on these calls. We've got well over 25,000 people focused on this. We are one of the clusters in the United States focused on digital health, and yet it's hidden in plain sight. We don't talk about it. We don't advocate for it. We don't showcase it as one of the KC area's unique capabilities. And yet, as this call demonstrates, every time John gets us all together, is we are filled with great ideas and great talent. But what we have to do is get the ideas connected to the talent, connected to the capital, connected to the companies, and connected to clients. And so the storyline here is Maria Flynn and I are working with the existing infrastructure in town. We're not trying to recreate, KC SourceLink. We're not trying to recreate Digital Drive. We're trying to be that catalyst. And at the economic development level, at the talent development level, at the capital, the attracting capital into the region. And we're bringing that together in something called Digital Health KC. So we just kicked it off yesterday. There's still lots to do. If you go to that site, you've got a digital health company, please put yourself on the map. We find companies every day, which is what's really been fun. And we find professionals that are working in digital health, but not on KC companies. So many of my former Cerner colleagues and former colleagues at NetSmart and WellSky is, as careers transition, they're working on Minneapolis companies and Seattle companies and Austin and Nashville, all wonderful things for the healthcare industry. But we're not keeping that talent helping to build your companies and to build your organization. So we have a lot of what we're working on is the advice and counsel around the talent side and trying to keep as much of that here focused on solving healthcare's biggest problems from companies that are based in the region. So that's basically what we're trying to do. On May 11th, we'll have our kickoff event. We're trying to attract both the entrepreneurs as well as some of the big influencers that and the folks that have been willing to invest in companies like yours and organizations like yours. So that's what it's about. We really appreciate Dennis's leadership and the board of BioNexus KC to help us get started. And again, Aaron and the team at Digital Drive for partnering up with John on both programs and go-to-market activities. So that's Digital Health KC. So look forward to learning more from you guys, and hopefully we can help you guys grow your companies and keep KC on the map as the hub, as the center of health and data. That's what our tagline is, guys. And we're really excited. It's a fun thing for me to do post Cerner. I'm really excited. I know the talent that's in this region and the ideas that are coming out of this. And so I'm trying to meet with as many of the early stage companies as possible and make sure we're getting connected. This kind of session's great, and hopefully I can reach out to many of you and we continue the conversation.
Sounds great, Dick. You want to say,
Aaron, thanks for doing that up, buddy.
You want to say about
Of course.
the event? You want to say about the event itself?
Yeah, the event's going to be on May 11th at Boulevard at the rec room up on the 4th floor of the Boulevard facility there. We still have some work to do to do invitations, and we're trying to figure out how much space we have and all those things. So it'll be May 11th. We're putting together the invite list, but if you have interest in the networking opportunity and others, we'll be including a lot of the folks from John's sessions here.
Sounds great, Dick. Thanks very much. Glad you had the chance to offer that. Okay, with that, I guess we'll sign off for this month. Please feel free to communicate with one another as you have well through the chat today. I saved the chat, so if you've missed anything, please just get a hold of me. I'm very happy to share what we found. So thanks again and have a great month.
Thanks, John. Appreciate it.
Bye now.
Yeah.
Take care.